Yes.
Yes.
Yes,
Yeah.
no.
Yes. Yeah.
Okay, thank you. So this is the TSB briefing, and you can see on screen, I don't need to go through that with you. You can see what the TSAB briefing says about professional curiosity. And I think this is what we have to work to. So asking why of ourselves and others, thinking outside the box to help build a fuller picture. And when we're working with, you know, assumptions about different types of families, we need to be testing those out much more clearly. So we need to understand if there is a policy and legal context about us being professionally curious, and that is actually enshrined in the Care Act. So being able to understand and fully assess a family, a person and their carer, if it's you know, a family member carer, then we know that the Care Act is saying that that's what we need to do to be able to deliver the best services we can. We have to fully understand the person and their situation, not just what they are displaying, but what they may not be displaying and what they may not tell you. But there might be that gut instinct there. There's also a 2019, which I know is quite old, but a 2019 article in the Journal of Adult Protection, and that discusses the expected social work practice and best practice for the whole workforce to be professionally curious. And I think if you look at what that article is called, Could Curiosity Save Lives? So that's an exploration, and it's a really good document to look at if you want to improve and understand professional curiosity much more. And it focuses very much on partnership working as well. So what are the blocks and barriers under case issues? So first of all, we're thinking about blocks and barriers in individual cases. So if we've got disguise compliance, we're thinking about where a person appears to be wanting support. So they're saying, yes, I'm going to attend this appointment, or yes, I'll have that assessment. But actually, it doesn't come to fruition. So either they don't attend their appointments, or you've agreed some course of action that when you then review hasn't been carried out. And whilst as a one-off, that may not be so much of a concern, when that is continued, we start to build that picture of disguised compliance. Knowing but not knowing, this is where that gut feeling issue really comes in. So you're feeling that something isn't right. So a practitioner may say to you as a manager, there's just something here I'm not sure about, and I don't know whether it's right or not. But they can't actually put their finger on what it is and why. So without the evidence, it's really difficult to know. So that professional curiosity there then needs to be a continuing of questions and understanding to try and gather the evidence for whatever that gut feeling is. Then the next one of recognition and accumulating risk. Each safeguarding issue is dealt with as an individual and new case. And we see this quite often in safeguarding adult reviews, where each referral in for a safeguarding issue is dealt with as something new without looking back at, well, what was previously happening. That may be more the case outside of adult social care, where someone's recognising there's an issue, they're making a referral, but they don't know that another professional's already referred previously. There may have already been a section 42. So we're thinking about how do we flag these issues on our systems so that we can recognise a cumulative risk. The rule of optimism is an interesting one, and it's a belief that the practitioner is working in a way that is allowing a strengths-based approach and risk enablement, but not really seeing that that overriding picture is still one of, a higher risk than the professional believes. And it needs a full review and case analysis to really understand whether we are applying a rule of optimism and whether we are really seeing what's happening. So the blocks and barriers from a practitioner's perspective, so the practitioner issues, are things that you definitely can help out when we're thinking about supervision and supporting a professionally curious workforce. So normalisation, that can occur where there's a known difficulty. So take the example of, say, dementia and somebody that's got walking behaviour, and the practitioner thinking, well, that's how they are, that's how they, that's how they're managing their issues of cognitive deficit. They're walking purposefully to somewhere or for something. But actually what we're not, and again, we're applying strengths-based practice, but what we're not recognising is the full risk. So there was an example in a safeguarding adult review where a person with dementia was walking with purpose, was returned by the police, who she was well known to community policing, was returned regularly to her home and no harm occurred. But when she then carried out that walking behaviour at night in the middle of winter, she wasn't found by the police and she died from hypothermia. So you can see how we can be at risk of normalising some of that behaviour. Also, there's another type of normalisation where if you're working in a particularly in a city area where you see quite a lot of deprivation, and you might, just recognise, well, this is how it is around here. And we start to normalise and not really see we're so used to working. Professional deference, this is quite a difficult one, but in professional curiosity, one of the things that we know is that the person that works with that person more than anyone else. So it may be the carer that goes in every day knows the person better. But when it comes to escalating and challenge and referral, it may be that the person is swayed by a high status professional. And what we see is that the person who knows the person best isn't really listened to in a way that they should be. Confirmation bias is where we've got preconceived ideas. So we're filtering out new information because you're not expecting it to be a safeguarding issue. So, for example, someone with with behaviour that challenges, or someone who is subject to moving and handling regularly and is frail and elderly, so therefore may bruise easily, that you don't recognise that actually there might be another explanation, because you're aware that, say, for example, in moving and handling, that they're likely to bruise, so you don't recognise that there might be something else. Also, an interesting case that I looked at in another area of the country, the confirmation bias that a young person with extremely difficult, complex behaviours and significant learning disability, who wasn't in a sexual relationship and was living between her home and a day centre, and they were the only other people in her life, when her abdomen was swelling, every other explanation was looked for rather than pregnancy. So the confirmation bias there was, well, she can't possibly be pregnant. And so therefore it didn't even come into their heads to think about pregnancy until there was movement seen of the fetus in the abdomen. Lack of confidence, having those difficult conversations, and how do you deal with tension and uncertainty, particularly if it's a family or a person who can be quite aggressive. So that's very difficult for practitioners to deal with. And as managers, these are the issues that you can help and support with. And we'll talk a bit more about having difficult conversations in a little while. So the third area we're looking at is those organisational issues, and particularly for yourselves, this is where either you can support here particularly, or you can escalate to more senior managers if you are not the most senior manager in your organisation. So what does good supervision look like? Do your professionals in your workforce have time and space and confidentiality? This isn't always a management issue. Sometimes it's that the practitioner keeps cancelling supervision, but also it could be an organisational issue, even higher than yourselves, where there just isn't the allotted time for supervision. We need time for that critical reflection. And as a supervisor, do you offer appropriate challenge that is supportive? Do you promote professional curiosity in your supervision practice? And supervision should be planned. It should be accountable, a two-way process which supports and motivates at the same time and continues that professional development of the person to become more professionally curious. There are different models of supervision though, and you're all from different organisations, and within your organisation, supervision might look very different. So for example, in health organisations, there are different types of supervision. There is clinical supervision, where you're looking at someone's clinical practice, and there may be separate safeguarding supervision, or safeguarding supervision might be ad hoc when a person recognises that they've got a safeguarding issue that they need to deal with. And also, are there ever opportunities in very complex cases to think about having some multi-agency supervision? Can you get together as managers with some practitioners and really tease out what the particular issues are in a case? That might happen through the HRAP process, where you're looking at particularly complex cases. The changes in practitioner is a difficult one. And one of the challenges here is, how easy is it to sustain people in a role rather than the constant churn that we often find in social care services? So thinking particularly about what we often see here is that start again syndrome. So if you do have to have changes in practitioner, is there a possibility of a handover, or could the handover come from another agency so that the person is not starting all over again with a new assessment? This is particularly difficult in trauma-informed practice, because where we're trying to build a rapport with someone and trust, if there's a constant churn in the workforce, that makes it really difficult. So professional curiosity, even without trauma-informed practice, takes time. So what we don't want to be doing is bombarding someone with questions at the very first encounter. So what can management do to maintain a workforce? Do you support recruiting and retention? How do you challenge your senior managers around making your organisation one that people want to work in? Do staff feel valued? Is there an open culture? And do they have access to good continuing professional development? And do they see themselves progressing? So all the things about recruitment and retention that we talk about has an impact on professional curiosity, which is why I've included it in this slide. The other issue that practitioners find really difficult is the pressure and complexity. So we get pressure from high workloads and pressure to close cases. Is that something that happens in your organisation or in your service? If there is pressure to close cases, then we can find that professionals just put aside those difficult conversations. They're unlikely to employ respectful challenge and concerned curiosity if to do that is going to elicit more complexity. And there could be an issue where practitioners just don't apply professional curiosity, because if you don't ask, you don't know. If you don't know, you don't have to do. And certainly you can see that in some professionals where they don't go that extra mile, sometimes because they're fearful of what they might uncover and can they cope with what they're uncovering. If they have a hurried approach because they need to close cases more quickly, then it's less likely that the person wants to share more, because they believe the person who's being assessed or who is the client or patient feels that the person talking to them isn't interested in their story. If they've refused all help and they appear to have mental capacity, do we then close the case very quickly, move to the next case, because actually it's easier to work with someone who's already motivated? So all of those things can be part of not applying professional curiosity. The issue that often gets thrown to you as managers as well is that autonomy versus safeguarding. So how do we allow professionals to apply autonomous practice and have that understanding that that balance of professional curiosity with respecting privacy? And that's crucial to safeguarding. So how do we do that? By applying clear boundaries. So professionals being really clear about the boundaries of their role, the information they need to be able to undertake their role, and what they need to know to ensure the person is safe. So that helps the person understand why they're being asked specific questions. Using informed consent is really important. So wherever possible, by obtaining that informed consent from professionals before asking for that information, it explains to the person why they're asking those questions and how that information will be used, so that not everything they disclose will be needed to be used. What can be kept confidential and what can't be kept confidential. So that informed consent's really important. Respectful inquiry is how you approach questions with the sensitivity and respect, and using those open-ended questions that allow individuals to share information at their own pace. And that's why we need to be able to build those relationships to enable that to happen. Sometimes, as you know, an assessment might take 2 or 3 contacts before you have the full information. Confidentiality, again, assuring individuals that their information will be kept confidential where it can be, but being clear about where it can't be. And the professional training. So our professionals on data protection, and actually data protection is not a barrier to sharing information where someone's at risk. And time again, we see in safeguarding adult reviews where professionals haven't shared information because they're concerned about breaching confidentiality and breaching data protection. So it's really important that we make sure professionals have had the right level of training to their role to enable them to share safely. And reflective practice. What do professionals have the opportunity and the time and space to be able to reflect on their practice, and using that supervision and support, so regular supervision that can provide that space for professionals to discuss their concerns with you as supervisors and managers. So, but that's not the whole picture. Professional curiosity on its own is not the whole answer. So therefore, when we're talking to professionals about professional curiosity, you can see from this Venn diagram that it has to go alongside information sharing and professional collaboration. So information sharing, just telling somebody else what you've discovered as a professional, or telling and supervising professionals to say to other organisations or other professionals, I'm telling you this information. But without collaboration, you won't get those best outcomes that come when you've got good information sharing, good professional collaboration shared with professional curiosity. So we can't just rely on professional curiosity. So what are some of those steps to professional curiosity? Could you use some of these titles in your own supervision? These are taken from the TSAB briefing, learning briefing, and I wanted to use these because I didn't want to use different elements that some other safeguarding boards use, but I wanted to keep it to what TSAB advise around professional curiosity. So the first one then is to look. So in your supervision, you could be looking at what you're seeing in the person that you're supervising. And what you're asking professionals and practitioners to do is to look at the adult and family. What prompts questions or makes a person feel uneasy? Are you observing in supervision something in a professional that you think needs further exploration? So you can see how you can use these for supervision or for enabling that curiosity in the workforce. Does what you see support or contradict what you're being told? And what we started to do now in professional curiosity is to constantly be asking why. Some of you that have been around for several years will know about the 5 whys. So constantly asking why, to get to the real nub of the matter. If we apply that in professional curiosity, we can ask why much more, and therefore we will see more than we appear to. Listening. Are you being told things that need further clarification? If a practitioner is listening to what's happening in a family dynamic, are we really clear about how members of the family are talking to each other and what they're asking of each other? Is someone in this family trying to tell you something, but they're finding it really difficult to express themselves? And again, what we want people to do is ask why. And you might be hearing something a professional say or a practitioner say in a supervision session, but actually you think there's more there. So can you tease out more in professional curiosity in your sessions with your staff? Ask. This is really clear. We need to ask them direct questions. When you meet a family, we need to ask about their vulnerabilities, and just thinking about, how do you spend a typical day? Who do you live with? When were you last happy? What do you look forward to? So there's lots of things that you can ask, and they're all part of assessment. And I think this is the most obvious part of professional curiosity, and the thing that people really understand, asking those open-ended questions. Clarify and triangulate. This is really that collaboration thing that we were talking about in that model that I showed you. So how do you triangulate? Who else is working with the person? Have other professionals seen the same thing as you? Are they concerned? So when you're in supervision, you're asking this of professionals. Ask them, have they spoken to other professionals? Ask, do they know if anyone else is involved, and how can they find out? What action has been taken already so that we're not reinventing the wheel? And are all professionals being told the same thing? I'm just preparing for a learning event this week of a gentleman who did have capacity, who died in a house fire. And one of the interesting things that I'm beginning to realise as I'm reading through all the information from other agencies is that this gentleman was actually telling different professionals different things. So the continence nurse has offered a commode. He's declined a commode, but he's told the social worker that he's having a commode delivered and that's going to help him with his continence. So is that because he doesn't really understand what's happening? So is there a problem with his cognitive ability? Or is he trying to tell one professional one thing and one another deliberately? And nobody seems to, and that happens quite a few times through the chronology. And it won't be until I meet with those professionals that I'll understand whether they ever had the opportunity to talk to each other about exactly what was going on. So I've added in this slide here, consider holding a multidisciplinary team meeting. Do you need to advise? And could you, as a manager, facilitate a multidisciplinary team meeting? And there is guidance. And when you see the slides, you'll see that there is a link to the guidance for multidisciplinary team meetings. So reflect, and this is the thing that I think we've talked about previously when we talked about time. It is really difficult for practitioners to sometimes find time. And I think one of the things when we talked about this issue with the professionals who were involved in the Susan SAR, which we're going to discuss later, that in our busy world, it's really difficult to find time to reflect. Do professionals have time to accept? Are they accepting a single piece of information at face value because they don't have time to reflect on it? Are they able to weigh up all of the information that they've collected from multiple sources? Are they able to seek independent confirmation of the individual's account? So do we know that what they're saying is actually the truth? And I'm not suggesting that people are lying, but just that their cognitive ability may be affected, or they actually might not be able to understand what's happening, so they're interpreting things differently. And also, are professionals aware of their own values without letting them influence their decision making? What is the information telling you as a manager, and are you asking the why questions? Are you able to be confident that professionals can challenge and use the Safeguarding Board's professional challenge procedure when required? And also, how are professionals sharing their findings and concerns with managers and yourselves? And how are they maintaining a clear focus? And are they thinking family? So what we sometimes see in safeguarding adult reviews is not just about we think family if there's children in the family and we've got concerns, but actually other vulnerable adults. So particularly in a caring carer relationship, cared for relationship, are there issues between the carer and the cared for that we need to think about when we're thinking family? So having said all of that, then what are the enablers to professional curiosity? We need to make sure that we are encouraging person-centered care, making safeguarding personal, because if we do that, we're more likely to gather that information in a respectful and sensitive way. Do our organisations allow time and capacity to be able to be professionally curious? Do our structure and working practices encourage professional curiosity? One of the things that professionals said when they were talking to us in the Susan SAR was very much about, hot desking and working from home more means that professionals don't necessarily have the time with each other. Those corridor conversations that people used to have, the over the desk conversations. Oh, I've just been to do a visit with Mrs. X and I was really worried about this. What do you think? Some of that's gone. How do we make sure it's there? Recording processes and procedures. Do we have records that allow us to write our rationale for the curiosity and the things that we've gathered? Or are our records very much, I've ticked, I've done that, I've ticked, I've done that? Where can people write their gut feelings and their curiosity? Are they having supervision and support in the way that we've discussed? Are they having access to safeguarding and legal literacy? So are you confident that they understand their legal duties and their safeguarding duties? Is there a learning and development culture within the organisation? Do they have opportunities to be trained and to ask those questions? Is there an open culture? And do our professionals work in partnership with other agencies and teams? So having those difficult conversations can be really difficult. And we know that the heart of professional curiosity is being actually able to talk to people about the things that our clients, our patients are finding difficult. So are we ensuring that there will be time to discuss what's required, or is the visit only going to be very, very quick? Be clear and concise. We need to make sure that discussions are focused on the topics that you need to discuss. That will help those difficult conversations. Do professionals have the courage and the focus on the needs of the adult? So are they focusing on the needs of the adult or not getting strayed off? And can you bring people back to being person-centered? Again, that helps those difficult conversations. Sticking to the facts also. People don't need to be confrontational and blaming when they're trying to elicit difficult information, but just the facts as you see them. So I noticed that you're surrounded by empty bottles of whiskey. You know, focus on the facts rather than, I believe you're an alcoholic. You know, so stick to the facts. Make sure decision making is justifiable and transparent. So being real and honest and having the evidence to back up what you say, rather than just, you know, where you're going to get that gut feeling evidence from. Do you need to triangulate more information to get that? Be empathetic and consideration and have compassion. You know, if we have people that are practicing in that way, they're much likely to be good at professional curiosity. And also be congruent. Make sure that what you're saying matches up with how you're presenting yourself as a professional. And you can try this out in supervision sessions as well. Are you saying to a professional that you really empathize with the difficulties they've got in the case, but is your body language telling them something different? Share with other professionals and look for evidence, which is what we've said about gut feelings. Understand the elements and indicators of behavioural change. So professionals need to know how they're going to help people on the change wheel. Do they understand how to make behavioural change? Are they being really clear as to whether what they're looking at is disguised compliance? Because everything that the person says they're going to do, they haven't really done. And also remember that there's no such thing as a silly question. Building a relationship with a person can help practitioners to delve deeper. So asking the obvious and delving beyond. And as we always say in safeguarding, think the unthinkable, believe the unbelievable, consider how you can articulate intuition into an evidenced professional view. And just I want to share this with you as managers and thinking about these actions to support curiosity. So this is a practice briefing that's quite old now, but it still is really good from a managerial perspective in applying this to your own managerial practice and to your organisation. So it gives you actions that will support curiosity. It gives you reflective questions. Could you then join with other departments, other teams? And could you push this higher in management to strategic planning? So I am going to